So cough is really a problem in patients with IPF, and a lot of them complain about the cough and ask us what we can do for the management of cough. Cough is usually dry, but a few of the patients have also some sputum of mucus, at least late in the course of the disease. And cough is really disabling for the patients. Some of them refrain from any social life because they fear that they will have very heavy and dry cough that is really problematic in a restaurant, for example, or in any kind of social life.